For meanwhile, I'm stopping the screen share, and after 1 minute, I'll just resume.
So let's begin, sir.
Yes.
Yeah. So hello everyone. A very good afternoon. This is Mayur here from Research Circle Organization. It's been pleasure that I can see the wonderful audience are here. We have an audience on the Zoom as well as on YouTube, and we do have a very expert today with us. I would like to give some brief introduction about him. He is Dr. Sayan Bhattacharya. Dr. Sayan Bhattacharya is a self-made academician, teacher, doctor, and researcher. He has 75 publications in various peer-reviewed medical journals. He is a member of IAMM, IATP, SIHAM, ISID. He also guided several students in their projects, and he also participated in INCLEN project in 2017. I welcome Dr. Sayan Bhattacharya on this Research Circle platform, and I really thank him for giving like his valuable time. So I would request Dr. Sayan to please go ahead and share your presentation, sir.
Thank you. Thanks, Research Circle, for this opportunity. I am Dr. Sayan Bhattacharya, Associate Professor in the All India Institute of Hygiene and Public Health, Department of Microbiology. So actually today I'll be sharing with you something about hand hygiene in the hospital setting. Now, hand hygiene is very important for all of us, for the medical personnel as well as for the other persons. So everybody should know something about hand hygiene, but it's more often relevant with respect to the medical. Now, first, at the outset, I'll tell you that first I'll share some PPT slides with you, and then I'll go for some hands-on demonstration or some hands-on practical session. So I can see there are a few participants, and many of you are joining. So I welcome you all, and I'll share my screen. Hope it is visible.
Yes, sir, it is.
Okay. One participant is having some issue regarding the display picture. I hope it is visible. Okay. Hand hygiene in the hospital setting. This is the today's topic. This is the logo of my institute, and this is Research Circle. And today is on 28th February 2022. And interestingly, very interesting, today is the National Science Day. National Science Day means on 28th February, the Raman effect was discovered. So by the Raman effect, I mean the scattering of light and how the sky becomes blue and the seawater becomes blue, everything was discovered. And today is also the International Day for Rare Diseases like motor neuron disease, spinal muscular atrophy, and multiple sclerosis. And these are all very rare diseases. And today is also the day for that, commemorative day for that. So today is indeed an apt occasion to discuss and study hand hygiene. Now, what is hand hygiene? We all know that palm of our hand has some bacterial flora. Now, this palm of our hand can have some transient bacterial flora as well as some resident bacterial flora. Resident bacterial flora means they are not easily removed by hand scrubbing or by hand washing, and you need metallic brushes and you need to injure your skin or epithelium to get rid of these bacteria because they're embedded inside and underneath the stratum corneum of your palm and skin. But the transient bacterial flora is variable and depends on what you touch and what you eat and whether you are practicing hand washing or not. That means they are subjected to removal by your soaps or sanitizers. Now, this is the bottle of sanitizer Now I have with my hand, and this is also another bottle of sanitizer, but these two are different. I'll duly explain to you. These bacteria of the transient flora can be removed by hand wash or even by hand sanitization. Give me 1 minute. So, soaps are there for hand washing, and alcohol-based sanitizers are there for the hand sanitization. Now, there may be some issue with the audio. I'll request the organizers to look into it.
I'll coordinate.
So, for hand washing, and alcohol-based sanitizers are there for hand sanitization. Hand washing is very important in the hospital setup in both the OPD and the IPD. OPD means outpatient department and IPD means inpatient department, as well as the HDU or the high dependency unit, the ICU or the intensive care unit, in order to tackle nosocomial infections by MDR pathogens. MDR means multi-drug resistant pathogens. Now, multi-drug resistance in tuberculosis means resistance to INH and rifampicin, mostly rifampicin. And multi-drug resistance in case of gram-negative bacteria indicates resistance to 3 or more classes of antibiotics. This hand washing can be about 2 types: social hand washing as well as surgical hand washing. So social hand washing we are practicing in the labs and in the everyday settings, before eating something, after defecation, before touching anything like that. And surgical hand washing is practiced by the surgeons before they are doing any procedure, whether minor operation or major operation. Now, in this regard, I will briefly go into the history of hand washing and hand sanitization. There has been a pioneering work of Laberac. This is the picture of Antoine Germain Laberac. He was a French scientist who discovered, in fact, he was a physician, who discovered a sodium hypochlorite solution that he could use for wound debridement or wound cleaning, not really hand washing. This was called Laberac solution, and in this same form or in a slightly deviated form, it is still used nowadays. And Semmelweis used chlorinated water for hand washing. This is the picture of Ignaz Semmelweis, the Hungarian physician, who used chlorinated water for hand washing. Basically, it also liberated hypochlorite. They established disinfection, hygiene, and safe hands as 3 primary factors for control over nosocomial infection. Later, a scientist called Mortimer upheld these findings. Actually, Mortimer was working with a few cultures of Staphylococcus aureus and methicillin-resistant Staphylococcus aureus, and then he found that those Staphylococcus aureus isolates also could be got rid of from hands and other surfaces using the same disinfectants or solutions, and he upheld these findings. Way back in 1975 and 1985, the CDC had published guidelines on the hand washing practices in hospitals. So before that, hand washing was not taken very seriously, but after that, especially nowadays, it is the single most important factor to control nosocomial infections or healthcare associated infections. So we all know that Global Hand Washing Day falls on 15th October and World Hand Hygiene Day falls on 5th May. Now today is the International Day of Rare Diseases, but some rare neurodiseases or demyelinating diseases can also have some infective etiology, and indirectly it also indicates that if we don't keep our hands clean and sanitized enough, we can acquire those infections, which can lead to those demyelinating or rare diseases. Now, the next slide highlights the important point that wash your hands. These 3 words are, in fact, the 3 most important words the world has heard since the COVID-19 breakout, which is the worst pandemic to hit the world in the past 100 years. We all know that a pandemic comes every 100 or 101 years. And now we are facing the third wave, and we are at the end of the third wave of the COVID-19 pandemic. Especially in this regard to this pandemic, this is very important. And at least 5 diseases can be managed by timely and proper hand washing or hand sanitization. These 5 diseases are, firstly, diarrhea, which you can get rid of if a person is having some infectious agent in his gut. If he practices good hand hygiene, he will not transmit it to others. And if through food, it can be minimized by proper hand washing and avoiding that food. Secondly, malnutrition. Malnutrition sometimes have infective etiologies like hookworm and other things. And if you practice good hand hygiene, you can minimize the chances of getting hookworm infection and other worm infections, which will not lead to malnutrition. See, worm infestation like hookworm, Diphyllobostrium latum, and others, Ascaris hookworm and Enterobius nana under the nails, the ova are found in children especially. So if we practice good hand hygiene and hand sanitization, we can definitely reduce the cases of worm infestations. Fourthly, cholera. Now, cholera, as we know, is caused by Vibrio cholerae of commonly 2 biotypes, Classican and Eltor, or a third type called O139, which is called Vibrio cholerae Bengal. And definitely hand washing helps minimizing the chances of getting or disseminating cholera. Hepatitis A, of course, is another very important disease which can spread through vectors like flies and cockroaches also, and obviously through improper hand washing it can spread. So definitely we can minimize the cases, the incidence prevalence of hepatitis A by proper hand washing. Now WHO and CDC have given these 5 movements of hand hygiene. I'll be discussing this in a subsequent slide, but let us look at this picture closely. Firstly, before patient contact, before touching the and I'll not randomly go to the patient, and I will just sanitize or wash my hands before going to the patient, touch the patient. Secondly, before aseptic task, like before any aseptic task, like I'm going and for that also I need to clean or sanitize my hand. Thirdly, after body fluid exposure risk, I need to sanitize my body and my hands because it can fall upon my mucosa like eye exposure and hand exposure and nostrils, and need to wear personal protective equipment, and I need to wash my hands also. If this spills on my hand and my skin has some skin injury. After patient contact, so before patient contact and after patient contact also, so that the patient does not get any bacterium or virus from me. And secondly, the patient's microbial flora does not come in my hands and thereby can spread to others. Fifthly, after contact with the patient surroundings. So fifthly, I have touched the patient's IV stand, my patient's bed rails, the patient's history sheet or urine catheter bag like this. And so I cannot just go to examine another patient after that. Before that, I need to sanitize or wash my hands. So what are the types of bacteria found on the hands? So the gram-positive cocci are Staphylococcus aureus, coagulase negative Staphylococcus, and Enterococcus. The gram-negative bacilli are Escherichia coli. These are the common bacteria. Escherichia coli, Pseudomonas aeruginosa, Acinetobacter baumannii. Sorry about the spelling. It will be baumannii. So these bacteria are really the transient flora of hands, which can easily be found on the hands, and you can easily get rid by proper hand washing or hand sanitization. Yeasts like Candida albicans are also commonly found on the hands, and these all we found in our study in AIMS Patna, Sarfaraz Jaiswal Bhattacharya et al. In JEMDS journal you can find Journal of Evolution of Medical and Dental Sciences. 2004. 1 minute. Thank you. Thank you. The unclean hands transmit these microbes onto mobile phone screen or surfaces and thence onto the currency notes also. So an interesting question comes to our minds that from where these bacteria come to our hands. They're normally found on the surfaces, environment, and other things. And so if we touch different surfaces, naturally they colonize our palm, which is rich with sweat and sebum. And so the bacteria can easily grow and multiply and thrive. Secondly, by handshaking. So the COVID pandemic emphasizes this thing, that is hands-free wishing or namaste. Never touch handshake. Never do handshake. You can do elbow shakes like that, or you can do feet shake, like the footballers nowadays do. So thirdly, by nose picking. Now, this is a very bad habit. Picking the nose is a very bad habit. Why? Because our external nose is rich in many bacteria like Streptococcus and Staphylococcus aureus and other bacteria like Proteus and Pseudomonas. And inadvertently, by nose picking, I can make these bacteria grow on my palm. And secondly, if any pathogenic bacteria like Corynebacterium others is there in my hands, I can transmit it to my nose, and then my olfactory epithelium and cavernous sinus also, and other things can also happen. Very severity can also be reported. And so this is very important to remember. And a number of bacteria and fungi are also found under the untrimmed nails. 1 minute. Thank you. So these are the 4 sources: surface, handshaking, nose picking, and under untrimmed nails. Some people like some, especially females or some males also nowadays, keep on lengthening their nails. They don't trim their nails, they cut their nails. This is considered very fashionable, but in fact this is very dangerous, because the undersurface of the nails harbor many pathogenic bacteria and viruses. Now the next slide emphasizes when to use soap. Like you can use soap also, you can use sanitizer also. But you just cannot use by your random will that now I'll use sanitizer, now I'll use soap. So when soap is recommended, first of all, you should have some hand wash or some tap or some basin nearby, because otherwise you cannot get rid of the foam. Secondly, see, something is coming up. When the hands are visibly soiled, so there is some dirt or some mud or some grease on my hands, these things harbor the bacteria and protect the bacteria from alcohol-based sanitizers. And so sanitizers are not sufficient to kill the soiled hands, means the bacteria of the soiled hands. So you have to use soap. Secondly, in the soiled hands containing soil or dirt, some spore-bearing bacteria are there. So we all know the spore-bearing bacteria are not killed by spirit or other alcohols. And so you have to use soap so that by detergent action, they go off. Also, in case of exposure to spore-forming bacteria like Clostridium difficile. So Clostridium difficile, once again, I was telling, it causes antibiotic-associated diarrhea and nosocomial pneumonia also. And in those things also, we need to use soap. And hand washing with soap and bacteria, and remove bacteria, and soap and water has to be used or advised for that thing. So when to use a hand sanitizer? When the hands are not visibly soiled. When your hand does not contain any visible dirt or any grease or something, it is clean like this, I will use the hand sanitizer. How will I use the hand sanitizer? Let me show you. So I have this thing on my hands. This is a gel-based sanitizer. I will drop this on my hand and then palm to palm, dorsum to palm, in between the fingers and interlocking and thumbs, then the fingertips, and then the wrist margin. So then, now as soon as it evaporates, my hands are sanitized. In all circumstances, hands should be washed before eating and after defecation. So hand washing needs to be done before eating and after defecation. So both medicos, non-medicos, common men, everybody. Now, I may ask the audience, you can answer in the chat box, what is this picture showing? What is this picture showing? What type of hand wash? There are usually two types of hand washing, social hand washing and surgical hand washing. So this tap is a specialized tap. This hand washing technique is also a specialized technique. And please note they are wearing the gown and mask, and this is before some operative procedure. They have donned everything, and now they are washing their hands, and then they will wear the gloves. This is a surgical hand wash, and they have washed up to their elbow. And then how will close the tap? Yes, surgical hand washing. Dr. Rajendran has replied. Very good. Now, how will they close the tap? The tap is open. The tap has a long handle. It's also called the elbow tap or elbow handle tap. So they will use the elbow only to close the tap like this. They will not use the hands. So a question comes to our mind, whether to use the solid soap or the liquid soap. Which one is better? Yes, using elbow. Solid soap is better or liquid soap is better? Solid bar soaps are good, definitely very good, and definitely older than liquid soaps. And the important thing is that they do not leave any chemical residues on my hand, but they tend to get colonized on their surface by bacteria. Yes, liquid soap is recommended. So liquid soap is better. And however, liquid soap can leave some residues. Solid soaps tend to get colonized by bacteria. So if you have to use solid soap, get it covered by some soap case, some clean soap case. If you keep it open, it will definitely be colonized by the airborne bacteria. Liquid soap is better. However, liquid soap can leave residues, chemical residues. How much volume of liquid soap or sanitizer is to use for hand washing or hand sanitizer? Approximately 2 ml. So if I use this much, so this thing, I'll show the palm of my hand. This much is sufficient. Okay. Same thing for sanitizer. And yes, Dr. Rajendran, multiple user by single soap is to colonize the bacteria. Multiple user also, and even the single user, if you keep the soap open and do not cover it in a soap case, definitely you will get many bacteria from the ambient air, like Bacillus cereus and other bacteria. Medicated soaps are better at removing germs from the hand than the non-medicated. Why? Because medicated soaps have some antimicrobial compounds or antiseptics like cetavlon, cetrimide, chlorhexidine, these things, and they not only remove the germs but also kill the germs. So they are better at reducing the transient flora of hands compared to non-medicated. So how it has been studied? Say I wash this hand with a non-medicated soap, and I wash this hand with a medicated soap. So if after washing and drying, if I ask a person to take swabs from both my hands and culture on solid media like nutrient agar, blood agar, or clay, I'll be seeing that the hand which I washed with a medicated soap has much fewer number of bacteria, statistically much lesser number of bacteria compared to the hand which had been washed by the non-medical agent. Now, this is a very important slide, steps of hand washing. I'll not go into written details, but I'll explain in the picture. There are 7 steps. First, the first step we generally miss to tell in exams or something. I have to wet my hands. I have to open the tap. Before opening the tap, this is another thing that is untold. I have to keep a clean tissue paper on a clean surface. The purpose I'll tell. Now, first step, wet my hands, then apply the soap by pushing or by sensor-based liquid soap, anything. Then steps, palm to palm, dorsum to palm, then scrub between the fingers and the finger webs, then interlocking between the fingers and the thumbs, then rub the fingernails, rub wrists, then wash your hand, and then you can dry with either single-use towel or the clean tissue paper you had kept beforehand. So moments or points of hand hygiene I have explained in the picture, 5 moments. So 7 steps, 5 moments. 5 moments or 5 points. Firstly, before touching the patient, after touching the patient, before and after body fluid contact, after touching patient bed and belongings, and before aseptic task, and from one patient to another. If you are finishing from one patient and going to another patient, definitely you will have to wash or sanitize your hands. Types of hand washing I have told, social hand washing and surgical hand washing. Commonly in microbiology labs and in normal OPDs or something, or our kitchen areas or our homes, we do social hand washing. Same we do before eating and after defecation, not the reverse. And surgical hand wash we do before any surgical procedures and also after any surgical procedures. So what is the composition of hand sanitizers? 40 to 70% ethanol or isopropyl alcohol is used for hand sanitization. So if I give you this hand sanitizer, this contains about 70% isopropyl alcohol, along with something else like hydrogen peroxide and chlorhexidine and some sodium octyl sulfate, some vitamin E may be there. To prevent hand drying, emollients like vitamin E or aloe vera are used. What do you mean by emollients? You can reply in the chat box. What do you mean by emollients? Vitamin E or aloe vera or glycerin. You can use one of these 3 things, any one of these 3. Non-alcoholic hand sanitizers are banned. So you may get some Ayurvedic and some herbal hand sanitizers. They contain some other volatile compounds like benzyl alcohol or something else. They claim that they do not tell it in their composition. They only tell that they do not have harmful ethanol or harmful isopropanol or harmful methanol. But in fact, they can contain more harmful benzyl alcohol, which is on one hand, it is ineffective to kill the bacteria. Secondly, it is toxic for your hands and your body. So definitely avoid these non-alcoholic so-called hand sanitizers. Alcohol-based hand sanitizers can be in gel or in liquid form. So either they are in gel form or in liquid form. So this one is in what form? This one, if it's not visible very well. Gel. And this one, yes, Patharpa has replied. And this one is in liquid. Both are good. It's not that the liquid one is better than the gel one or the gel is better than the liquid. So other than alcohol, these sanitizers also contain some other elements like hydrogen peroxide and chlorine. So let me read the composition of this liquid hand sanitizer. And composition is ethyl alcohol and perfume base and nothing else really, but something sometimes they contain. It also contains a dye like copper sulfate or brilliant blue. What is the purpose of adding this dye? This purpose of adding this dye is so that nobody drinks this alcohol, because this is practically ethyl alcohol. You can dilute it in water or soda or carbonated drinks, and they can consume it. But if it contains beryllium blue or copper sulfate, definitely if the person drinks it, he will have some vomiting or diarrhea. So to prevent that, we use some indicators, and also it helps in identification. One should wait till the alcohol evaporates fully. Only then your hand is properly sanitized. I have two of my students sitting here who will help in my practical demonstration. They are listening now also. Now I am almost at the end of my PPT, but before I end, I need to tell you something like what are the advantages of this hand sanitizer. These alcohol-based hand sanitizers is preferred for the routine hygienic disinfection if the hands are not visibly dirty. When compared to hand washing with soap and water, it is not only more rapid, it is easy to do and also quite effective and also better tolerated by hands. Means your hands are more damaged by frequent hand washing with soap and water than is compared to the hand sanitizers, which normally people think otherwise, that hand sanitizers are more harmful than soap. It is not, but it's not true. Steps are same as in hand wash with soap. So steps are same, 7 steps. Now, why we are all discussing the hand sanitization? All doctors and nurses and students seem to know, but this is still important to be discussed because the healthcare providers wash hands less than half the times they should. Means they do not follow really the 5 points or 6 points of the hand hygiene. So they wash their hands in less than 50% of the times. So they only do 2-point or 3-point hand hygiene. It's not correct. Hand hygiene is documented to be the single most important factor for preventing healthcare associated infection. If we do just 2 things, proper hand hygiene or hand washing, hand sanitation. Secondly, proper biomedical waste segregation and disposal. You will be seeing that your nosocomial infection incidence and prevalence will be cut down by 90% or 100%. You will not get any infection. Thirdly, third important thing is you have to prevent crowding. You have to maintain spacing. If you do these 3 things, you will rarely encounter any healthcare associated infection. Especially hand hygiene is the first important factor. Now modern technologies are there. Like to minimize touch, we are using some sensor-based hand sanitizer. So I'll be showing you this. We have this in here. This is the picture of our own sensor-based hand sanitizer outside our department. So what happens if we just put our hand just underneath this sensor compartment? This is the sensor compartment. Put your hand, but it should be connected to power. It should be on. Now you put your hand underneath. It will make some sound and will disperse some 2 ml of hand sanitizer on your hand surfaces in a mist-like fashion. It will not drop like a water drops or tap. It will drop like a mist. Then you take your hand out and perform your hand sanitization. So this is advantageous because it does not lead to touching and it is easy, rapid. You can just remove your hand and perform your hand sanitation while walking away. And the only disadvantage is that power connection is required and the refilling of the hand sanitizer is periodically required. And some checking or servicing is also required, which becomes sometimes difficult in the hospital setup, especially in the government hospital. But this is very important. This is also called a hand sanitization station. Now we all have known by this time how we should wash our hands, with which we should wash our hands. But for how long should we wash our hands? The Indian government recommends a minimum of 20 to 25 seconds. And in foreign guidelines, especially for the surgical hand wash, it is more than that. It's 40 to 45 seconds. 20 seconds is the minimum time for social hand wash. Now, after washing, the hand should be dried. During hand washing, ideally the nails should be trimmed. If you have some nurses or some doctors who are fashionable enough to keep some long nails, please bar him or her from attending or from assisting the operation or some dressings. And the rings, sorry for the spelling, the rings should be removed. The rings should be removed because these rings, even I am wearing rings. So underneath these rings, some bacteria and fungi may be there, which are shielded from the soap or sanitizers. So unless you remove them like this, you'll not be able to remove the bacteria which are present underneath those nails, those rings. Surgical hand washing, tap should be elbow tap, I have told, be closed by the elbow. Now, another important point, social hand washing is up to wrist. I'll be telling this once more. Surgical hand washing is up to elbow. And after hand washing, the tap should be closed by a clean tissue paper. Thank you for the lecture. Now I'll start the practical demonstration. So look at this picture. After all the COVID messaging and drills of preventive guidelines, only about half of the healthcare workers washing the hands for the mandated 20 seconds. So this needs to be improved. This is a 2020 report. And secondly, all people should realize that I need to wash my hands when? Before eating, after defecation. And it is important to wash my hands to keep the germs away. So this keeps many pathogenic germs away, both in the hospital setup and also in our daily life, especially in our hospitals. These are my references. These are three very important references from the PubMed, CTC, and our own published article in JEMTS. Thank you. Now, please stay put for the practical demonstration. Now, okay, Biman, thank you, sir. Okay, welcome. Dr. Parthara, I am visible. Welcome. He is a neurologist from UK. And so, Biman can come here. Just drop hand sanitizer. So this is a spray-based hand sanitizer. 2 ml like this. Got some to pump in between fingers, interlocking fingers, then thumbs, fingertips. Okay. Keep it here. Now, Aminul, you can come. Oh, they are actually doing thesis under me. So I will draw. Aminul, come in front. Place your hands on in front of the screen so that everybody can see. So I'll be dropping the gel-based hand sanitizer, 2 ml. Now show me the steps. Yes, palm to palm. Then dorsum to palm. Yes. Then hands little above. Then in between fingers. Okay. Then interlocking the fingers and the thumb. Okay. Then no. Before that, fingertips to the palms. Then your wrist. Okay. Okay. Now it is effective once it is dries. Now I'll take this mobile near the hand wash, means soap hand wash. দেখা যাচ্ছে বেশি বিমান আমি না না वो तो क्या कंप्यूटर कैमरा ना ठीक है anyway so this is what
So what is this? What is this? This is a liquid soap. So I'll be dropping this liquid soap. Now, I have washed my hand. I have washed my hand, and then after I use a clean towel to, I will use a clean towel to dry my hands like this. Sujita has told something. Yes. Let me look over it. So, I hope I'm audible there.
Okay. Yes, sir.
Now, Biman can. Biman, you put on your video. Focus that side. Switch on your video. I'm just asking Biman to help me. Focus on that side. I'll be holding. Is this thing visible? Perform the steps. So, first open the tab. First open the tab. Biman is opening the tab, wetting his hand. Okay. Now I'll be dropping the liquid soap. No. Keep the tab open. Yes. Now perform the hand washing steps. See here, everybody is looking palm to palm, then palm to dorsum, then it will be in between the fingers, and then the. Everybody please look at Biman's phone. Yes. The thumb, wrist, and then okay. Now I'm going to also switch on your video. That's the video. Please look at Biman's phone. Okay. Right word now? Okay. Take it. A normal liquid. Now, yes. Now I'll do one thing. I have to move from this room for the sensor-based this demonstration. For the sensor-based demonstration, I have to move to the corridor. So let me log in from the mobile, and then use Spotlight on my mobile. Okay, just let me log in from the mobile. Please let me in from my mobile. Yes. It will take a few minutes. Yes. So let us move.
To. Let us move to the corridor. Camera ta ki kore start video on korlam. Let us spotlight my this video only. on my phone. I'm working there. I'm on the corridor. So yes. So this is the sensor-based hand sanitizer. Now anybody hold my phone like this? Yes, just steady, huh? Okay. Show the entire thing. Show the power connection also. Okay. Yes, show the power connection. This is connected to power, and then this is the sensor. So what I will do, some sound is coming and it has spread some sanitizer over it. Now, 7 steps. I'll let it evaporate. Then it is fit to be used. So here I'd okay. So I mean, can you do this? I'll hold you. Working? Yes. Steps you do. Palm to palm, dorsum to palm. Please count the time. It will be 20 to 25 seconds. Yes. Okay. Thank you. Now let us go back to my room.
Yes. Now, have you all seen this understood?
I hope you have watched and seen and understood and were able to hear. Yes. Okay. Okay. So now the practical session has ended.
Now I'm ready to take any questions from you. If any questions is there, the host can tell, or the host can ask the questions to me on their behalf from the chat box. Over to Research Circle host.
Well, thank you so much, sir. It was a really good experience. We got a practical exposure, so that's why we were pretty interested and we were watching very cleanly. And yes, we got a 7 steps, and definitely we will try it. In fact, when you were demonstrating at that moment, we were trying on our hand as well to just remember all those things. So thank you so much. Few yes, people would like to ask the questions. Yes, you can ask one by one. Someone raised the hand. You can ask your question. Yeah. Partha
which one is better? One in the chat box. I can see which one is better, gel and gel or liquid. And Dr. Bhimandev asked which one is better and having less side effects. Yeah. You mean to say with the soap is having less side effect or the sanitizer like that? Actually, the soap is means better at eradicating all microbes, but leaves more dryness and residues on your skin. And which one is better, gel or liquid? Both the things are equally effective. But in most of the situations, people are using more, especially in the hospital, IPD and OPD, use more of liquid sanitizers compared to the gel sanitizers. Perhaps they spread to the hand surfaces more evenly than the gel. Yes, Dr. Parthura, please unmute and ask.
Yes, thank you very much. I must congratulate you, Dr. Sayan Bhattacharyya, for doing a wonderful program on a neglected issue in modern medicine. You took me back to a ritual when I was an intern in 1989, 1990, when we were taught how to do hand washing as part of surgical scrubbing up. It was a full ritual where we had to apply extra hot water on our hands up to the elbows, close the taps with the elbows, everything that you showed us now. I'm sure the surgeons still do it, but physicians and general doctors, and I'm coming to our colleagues in the medical sector as well, have, I think, put infection in the background till COVID came. So this has been a good learning point about the role of infection in modern medicine, which we must learn. We have learned in the last 2 years, and we must now carry it on as an important tool, because as part of the antibiotic stewardship prevention, which is this hand hygiene, is very important. So my points of question is that how many ITUs in government hospitals and in corporate hospitals have this sensor-based hand hygiene machine installed? If not, why are they not doing it? And have you suggested to them that they must have it at every door? That's one. How many posters of hand hygiene that looks us in the face as we enter into any ward or any hospital setup are there? Second thing, most important thing is that we doctors, I think, are most guilty in generating the superbugs for which there is no more antibiotics coming. So if we prevented cross-infection by doing it the proper way, like you showed us, 20 seconds to 26 seconds or 40 seconds, our Prime Minister, not my Prime Minister, UK Prime Minister Boris Johnson said happy birthday 2 times is equal to 20 seconds. So something like that on the Indian format, any song which we can sing for 20 seconds, just to give doctors a sense of time, before they change.
Yes, our national anthem is for 22 seconds, I think.
Is it? Okay, fine. I was not going to suggest it because national anthem is very precious to me.
First 2 lines is for 22 seconds.
So anything that works, and people should be standing. So of course they're actually standing when they're applying hand wash. Yes. So some suggestion to give people a sense of time. That's important. And I think our nursing DDs, our general duty attendants, and everybody who touches a patient in the hospital needs to be sensitized with all this. It's not only doctors who are spreading infection. We are possibly.
Actually, I shared. Yes.
So these ones.
Means that they are sometimes reluctant to participate in these webinars or these programs also, because they are not so well versed with these webinar platforms, still not so well versed, especially in our country or in the eastern part of our country. They are still not very well accustomed, especially at this time, maybe at this time of the day. So, but I had shared this and I have tried to convince them, but every time we mostly get the students, either the medical or the veterinary or the nursing students or the doctors, but definitely it is the duty of the doctors, the noble duty of the doctors or the medicos or the nurses to disseminate this thing to the general public, and also our technicians and attendants who especially need to be motivated to practice these things. And secondly, especially regards your question in the sanitizing dispensing machine, the sensor-based machine, very few hospitals in the government setup are having these sensor-based machines. But in Kolkata or in cities like Chennai or Hyderabad or Bengaluru or Delhi, most of the corporate hospitals have this. But in the government hospitals, due to logistical problems or other things or other maybe some delay, file-related delay, we are not being able to either procure this or to manage this or to service this. You have to refill this regularly, and you have to have a stable power connection also, because without uninterrupted power supply, it does not work. So, but whatever we have in our arsenal, we should try our best to mitigate this burden of MDR infection and other this escape pathogens, which are normally very commonly carried on our hands. So I think this is the way forward from this time.
And hand gel stewardship, each of us here could become, a cluster effect. You have taken the lead. I've not heard any other hand hygiene, hand washing talk from Indian platform. Good for you to be the pioneer.
Especially the organizers wanted to host as a webinar only, but that was correct, but that was true on their part. But I felt that not only webinars, some practical sessions, some hands-on sessions needs to be there. And I'm thankful to the organizers that they agreed to it, and they were very cooperative in throughout this. And secondly, one more question from you I could not answer. That's this hand hygiene, the steps, posters should be demonstrated.
Yes.
How to wash their hands, definitely. I do not see much of these in either the government hospitals or the corporate hospitals in Eastern India.
Yeah.
But in Southern India, as I have gone to AMR duty or other things, in every primary health center, in every BPHC, in every healthcare facility, they have a poster of the hand wash steps or hand hygiene or hand sanitation steps in color in both the languages, English as well as vernacular, so that people can relate to it and understand. And not only at the proper hand wash facilities or the biomedical waste facilities inside the hospital, but also in the OPD area, so that general people also get an idea of how to go about it. So this is very good, and we should take a cue from them. But again, we have to devise some time and some effort for so that people realize these things.
Some of the pharma companies who prescribe, who actually sell high power antibiotics, very costly ones, would be the best ones to do it, because they can then be seen as being helpful to society. You know, not only selling 4,000 rupees antibiotic per dose, but also doing some social duty by spending the same amount, printing of 50 posters which they can hang up. That might be a good social call for them. The other thing I was saying
was in their corporate social responsibility.
Yes, because
they should be incorporated.
Exactly. Not only are they selling expensive antibiotics, but they're also doing the social part to prevent that. That will show them in a good light. And you are in the right position. I'm coming up with ideas so that you can guide them. Maybe they will do it tomorrow. And our Bengali and our Indian patients and population are very receptive to all ideas, Just that we have not given it to them because we haven't had people like you giving these lectures. And when I actually started off in 94, we were taught as part of an induction to be a junior doctor, senior health officer in England, how to wash your hand. And I still remember, after washing the hand, if you put your hand in the infrared machine, you will see so many parts of the hand are still remaining wet or haven't been by the antibiotics. So just by you trying to go within the web spaces, between the thumbs, those are the areas were very difficult to reach as part of normal hand washing. So you have done a very good job in preventing a lot of mortality and morbidity, including in intensive care and antibiotic problems, because not many new antibiotics are going to come for the highly resistant bugs, super bugs. And this will go a long way in stopping that by doing, spending a few hundred rupees will be saving thousands of lives for the international world because of cross resistance. Thank you.
You're very correct. And one more question was there. Is it safe for children? Yes, it is safe for children, but I don't know whether it is safe for very small children or not. I don't have any idea, but definitely for small children, they are relatively safe. Sanitizers do not have any adverse effect unless they consume it inadvertently. Then they may be having some adverse effect. But if the parents keep it in check, yes, sir, Dr. Pastor.
One more thing, we doctors, I was just reflecting on my own practice, use a stethoscope on one patient.
Yes, diaphragm of the stethoscope. Yes.
What message do you have to give to very senior doctors who
yes,
are?
I was going to tell about it, but actually this is also fomite. Means our mask is a fomite, our goggles is a fomite, and our diaphragm of the stethoscope is also a very good fomite because it has some nitrocellulose or some rubbery material which colonizes with bacteria very rapidly. And then from the skin of one person to the other person, you should use some alcohol-based scrub just to clean it for a few seconds, the diaphragm, and then dry it, and then it can be used to check another patient. So that is practice nowadays. Even our mobile phone surfaces, our screens of our mobile phones, if possible, they need to be, especially in the hospital setup, or even the computer or other monitoring devices need to be periodical, because all of these are colonized very rapidly by microbes and they can act as fomites.
So why don't you set up a hand washing steward in the high risk areas, ITU, big wards, oncology ward?
That should be, but in our hospital is actually a teaching and public health hospital mainly. Although we do have a OPD facility and some beds also. But yes, definitely that hand hygiene towards this should be on our cards, and we'll definitely try to implement it.
Maybe a
As fast as we
designated
can.
nursing, maybe a designated nursing Didi can take up that
Definitely.
role. She will
In the OPD
monitor the
areas,
whole
nurses can be given that responsibility. Can be
role
designated.
because we have infection control nurse here who actually can throw me out of the ITU.
Yes.
Bare below the elbow, rings are also a problem. So we cannot wear wedding rings or no fancy
Definitely.
ring,
No rings.
no rings, no watch,
No rings, no long
right?
nail.
No
Watch, wristwatch
watch,
also.
no wristwatch.
Wristwatch only if you do some surgical procedure or some minority, definitely you have to remove the wristwatch.
Yeah.
But otherwise, wristwatch may be used if it is just below this wrist level. Maybe. But still better not to use.
Prevention is better than cure. Thank you.
Thank you so much, sir, for asking this question. Frijita Ghosh has asked question on like chat box. Is hand sanitizers are safe for children?
Yes, I was answering that question only. It may be safe for children, but not maybe very safe for very small children, because they tend to consume or put it in their mouth. If that happens, then it may be unsafe. But otherwise, it is relatively safe. But still, for very small children, it is better to go for hand washing by mild soaps rather than hand sanitizer.
Okay. Thank you so much, Dr. Sayan Bhattacharya, sir. It was wonderful webinar. And yes, when you were discussing with Partha, sir, so at that moment, I was discussing with my teammate and we decided that we're going to crop one clip from your webinar where you have like demonstrated that 7 steps to sanitize our hand. And I'll definitely share it with you and with everyone with your permission. Yeah.
Yes, definitely. One question in the comment box:
Yes.
in our college we are not allowed any rings. Yes, definitely. Which watch or religious threads or anything, but these are obviously they are formats, so they should be looked into. Yes, you'll be sharing some video or something, or YouTube link.
Yes, with your permission, I would be
Yes,
sharing
definitely.
a video of that 7 step to sanitize our hand.
Definitely.
Yes.
Now or later on?
I'll need a 1 day of time like to do
Yes,
the editing
definitely.
process.
If you once you prepare it, just send it to me. I'll look over it, and also I send it to my colleagues.
Yeah, sure. Before uploading, I'll share to you once. Yeah.
Yes, definitely.
Yeah. So thank you, Dr. Sayan sir, for giving this wonderful speech. I would also thank every participant who has like came over here and participated in this presentation. Even the like audience who are live on YouTube, who have watched this YouTube video webinar on our hand hygiene in hospital setting. So I thank everyone, and I
Yes, please
declare
send
that
me
this.
the YouTube link.
Yeah, sure,
The
sure. I'll
YouTube
do that.
channel.
I'll do that. I'll do. So I declare that this webinar is over and done for the day. Thank